Hey guys, and welcome back to the Ketogenic Nutritionist Podcast. I'm your host, Temple Stewart, and registered dietitian. I'm so excited to welcome our next guest. He is an obesity medicine certified doctor and works with clinical obesity every single day. He is truly a professional when it comes to metabolic health. His name is Dr. Kevin Gendreau, and he has an incredibly inspiring story when it comes to weight loss. He's overcome so many challenges and has maintained a 125-pound weight loss. He is so inspiring, and I know his story is going to inspire you as well. So hang around, listen to what he has to say, how he lost his weight, and how he encourages his patients to do the same. Thank you for being here. Hit that subscribe button, and thanks again for following along. Dr. Gendreau, it is an honor, a pleasure. We have become friends. I saw your first podcast on Life's Best Medicine with Dr. Linskis, and I have just been so inspired by your story. So I just want to thank you for gracing us with your time. And I know you're going to be so inspiring to the people that are listening to this. So thank you for coming on. And I'm just so excited to hear your story and more about what you do.
Thank you so much for having me. I appreciate it. Also, I'll probably just apologize in advance if my dog decides to bark during any of this podcast. It's just part
Yeah,
of life.
no, life. I just have my dogs downstairs, so we're all good. We're all good. Well, let's start. I again, your story is just unbelievably inspiring, and I think it needs to be just put on blast. So, just start from the beginning. Tell us kind of, from childhood and what got you to where you are now.
Yeah, so I am a full-time weight loss doctor now, these days, but it took me kind of a long road to get here. So um, really all of this started a few years ago when I was a practicing primary care physician and weighed 306 pounds and was diagnosed with type 2 diabetes, high cholesterol, high blood pressure, fatty liver disease. Had a lot of metabolic dysfunction and comorbid conditions that came with being morbidly obese. And so that's kind of how my weight loss journey started a few years back. But we could go back to childhood just to talk a little bit about how I gained all that weight to begin with and how I became a 300-pound doctor to begin with. Honestly, my childhood from 0 to 17 was pretty uneventful. I was active. I loved martial arts. I ate my fruits and vegetables. Everything was pretty good. But when I was a teenager, I was 17 years old and my father was diagnosed with metastatic melanoma. And so they found cancer all over his body and he had to have multiple different rounds of chemotherapy and radiation. And he had surgery after surgery. And despite all of these measures that we took to try to combat this horrific skin cancer, he unfortunately succumbed to the disease. And so over an 18 to 20 month period after diagnosis, he just battled nonstop against skin cancer. And through that process, when he was still alive and during his hospice, I just started packing on weight like crazy. And so during this time, when I was 17, I started my undergraduate at Boston University, and I was pre-med at the time. So I already knew that I wanted to be a doctor of some kind. And I just, instead of the freshman 15, I really gained more like the freshman 50. During my first couple years of college, I was just packing on weight. And that's what so many of us do. We have this inappropriate relationship with food, and I was just eating my feelings. And so unfortunately, in dealing with that and after he passed, in coping, I would just turn to food in order to process his passing. And so between how hard undergrad is and then even harder medical school and residency, I was just gaining 10, 12, 15 pounds every passing year. And then before you know it, you wake up and it's how did I get here? 306 pounds, type 2 diabetes, hemoglobin A1C 8.7, HDL in the toilets. All of my labs were horrendous. And I'm a doctor giving advice to patients, which is almost impossible to be 300 pounds and giving weight loss advice. I'd have a patient who is pre-diabetic and 240 pounds. And it's they're not even as far along as I am. And I have to give them advice.
Yeah, it's imposter syndrome. Yeah, you feel it.
Exactly. So I was not practicing what I was preaching. But I feel being part of, like the very classic pre-med track, MD program, residency, like they don't really teach you that much about metabolic health. Medical school, as you know, is so much about like putting out fires that are already brewing. Like
Mhm.
it's too late. By the time you get to an 8.7 A1C, it's like there's so much that could have been done for 10 to 15 years before that. And the focus, a lot of the time, was really not on prevention. Like in my schooling, it was just on, pharmaceuticals and the pathophysiology of what was happening, but not so much about like, how do we prevent this? How do we prevent diabetes, reverse diabetes? How do we stop hypertension from taking hold? And so I learned so much like on my own, and decided eventually to switch from weight loss medicine primary care into weight loss medicine. So I took this primary care path thinking like, I want to be part of preventative medicine and I want to like be part of prevention, because if only my father's primary care doctor had looked at his skin, he would have seen that there was this like melanoma brewing for so long before it turned into, metastatic disease that ended up killing him. So it was back in 2016, August actually of 2016. I my sister was recently diagnosed with cancer herself, and she was 30 years old and diagnosed with this rare form of ovarian cancer called a germ cell tumor. And upon her being diagnosed, I just like took a step back about my own health, thinking like, here is this young mother of two who is my sister and best friend, and she just, having been diagnosed with that was like not a choice. Like whatever you're dealt, like the cards that you're dealt as a mom, it's just like, I will do whatever I have to do for my kids. Like I'm going to do it. So she just had to do it. She had to do the chemo. She had to do the radiation. She had to do the surgeries. She went to Dana-Farber in Boston, which is like one of the best cancer hospitals in the entire world. And like whatever they're going to give her, whatever's on the plate for options, it's like, just give me the strongest and best chances to survive. Whereas I'm over here, like 306 pounds, eating myself to death slowly but surely with
Yeah.
diabetes. And I don't want to follow up with my doctor about my 160 over 110 blood pressure. And so it just like, it put everything in focus for me. When she was diagnosed with cancer, I was like, okay, well, what I'm doing is actually like choosing to have metabolic dysfunction and poor metabolic health by putting the wrong things in my mouth. Yes, I have genetic predisposition, so I'm walking around with like a loaded gun all day long, but every single time I eat chips, cookies, crackers, cereal, chocolate milk, I'm just like pulling the trigger one after the other. And so I really like shifted my view process and switched to a low carb, clean diet, like lots of protein, veggies, and ended up losing 120 something pounds. And when I did that, I shared my story very publicly on social media. And so like my Facebook page and Instagram and Twitter blew up, and people ended up like following this whole weight loss journey of mine. And they found it very interesting because I was doing it while being motivated by my sister's illness, and also doing it as a doctor who like hadn't taken my own advice for all this time.
Yeah, I love it. And I think it's so cool that you were so motivated by your sister and her legacy and doing that for her. And I think finding that like internal motivation, or that something that just, it sounds like something just really clicked for you, that really just set you off. And I think that that's so important for people that decide to embark on this journey. It sounds like you just really had an eye-opening moment that you're like, I really, really want to change, for me, but really for her and for everyone else. Was it something like that?
It was exactly like that. And I think like people have, I've seen like thousands of patients at this point for weight loss, and like everyone has their own thing. And a lot of the time we get so like complacent in our own metabolic health being so dysfunctional. Like we just kind of, I feel like you just kind of like lean into it, like, oh, it's fine, like it's easier to just be fat. Like that's like the most frank way to say it. Like it's just easier to just do that, because everyone else is eating cereal and bread and pasta and chips and cookies and crackers. Like who cares? Like I'll just eat the same thing as everyone else, and I'll just like be like unhappy and fatigued all the time.
Yeah.
Which sounds crazy, but like
Yeah.
until you get like some kind of fire has to be lit under you. And for some people it's like the day they're diagnosed with diabetes, like it's done. Or like the day the doctor tells them you have to start a blood pressure pill, they're done. So I don't know what it is for each person, because it's always going to be different. And that's why like these individual appointments that I have with patients are like so interesting. But at the end of the day, like you have to really find your reason why you want to make the change. And for me, it was like such a profound reason. And I think it's like very relatable the way I got there.
Yeah, no, I think it's really, I think it's super inspiring. And I encourage when I see clients is to really dig deep, really dig a little bit beneath the surface. The surface stuff is great too, fitting in clothes, looking good in the mirror, all that. But, staying around for nieces and nephews, staying around for kids, for people that love you, I think that is when you really look under the surface a bit, you can really, really dig deep and find that inner motivation. So I think that that's super inspiring for you. And I know she's proud of
Also,
you as
just like,
well.
thank you. I appreciate that. I was
Yeah.
gonna say, just like feeling better every day is like so
Yeah.
worth it. Like, it's such an understated thing. Like, having energy to get out of bed, like wanting to like roll out of bed and get the day started, and not just like, I don't know, curl up in a ball and be up late at night and then sleeping in every day, like on the weekends, like wasting your life away, like all the time that you could have been having fun, you're like sitting on a toilet because you have diarrhea from how bad you're eating.
I
Like,
know.
it's
Yeah.
horrendous.
Yeah. Did you find that your confidence as a physician too, like as you started to lose weight, as you started to lower your blood pressure and you notice your labs improving, did you find your like confidence as a physician really peaked as well?
Yeah, and it was also like this whole process of just like learning how much I didn't know about metabolic health. Like, I just feel like every paper that I read or piece of knowledge that I gained just made me feel more and more confident and out of my shell, because I was definitely like, being 306 pounds as a doctor, I was just like in a shell, and I felt like invisible and kind of like super shy with patients, because you don't want to say the things that they have to change, because you don't want to admit that you're not in fact doing those things. And so it's super hard. There's so many like cardiologists and pulmonologists and primary care doctors that are just like not practicing what they preach, and it makes it really, really hard for patients to take what they're saying seriously, or just like take what they're it's not even just seriously, it's more like, are you sure that that's what works? Because if you're doing that, it's not working for me. Like, if you're following a low fat diet and calorie counting, and like, that's clearly not working for you. Like, you must be listening to USDA recommendations from
Yeah.
1978.
Yeah. Yeah, yeah. Did you just stumble and fall into the low carb space? How did you kind of get into, I know you're obesity medicine certified now, but how did you kind of get into that realm? Because that is quite the alternative, quote unquote, way of thinking when it comes to metabolic health. So how did you kind of fall into that realm?
When I was overweight, I had tried like the classic Weight Watcher Nutrisystem, low calorie, low fat, portion control, like all the conventional
Yeah.
wisdom when it comes to like losing weight, and none of it really worked. Like, I would join Weight Watchers, and like, you can eat pizza and
Yeah.
sandwiches. So it's like, okay, I'm going to spend my points on pizza and sandwiches. Like you're never going to lose weight because Weight Watchers doesn't address hormones. So like, on all of those conventional diets, hormones, biology, science, none of that was ever addressed at all. And so taking that kind of approach didn't work for me. So the first step that I took was like, it wasn't like, oh, I'm going to be on a low carb ketogenic diet. It was, I'm going to eat almost no ultra processed food. So I decided, like, if it went through a factory or facility, I'm just like not going to deal with it. I'm going to do all like meats, veggies, berries, nuts. And so it was almost like a Whole 30 slash paleo approach. Like, I didn't have a name for it really. I just was like it, but it was low carb in and of
Yeah.
itself, because when you get rid of all the processed garbage, all that's left is just like clean proteins, fats, and fibers. And so it was a very low carb diet. I went back and calculated like a typical day that I was eating back then for carbs, and it was usually between 40 and 60 grams of total carbs a day. And so I was just low carb without realizing, like, I wasn't like intentionally calling it that. And so I lost like 75 pounds doing that, just like cleaning up my diet, no bread, no pasta anymore, like nothing, no crackers. I threw out everything in the cupboards that was like, something that would be staying in a cabinet for 3 years was something that I immediately just like threw out. And most of the stuff that I ate was like fresh, or just like frozen vegetables, frozen berries, and things like that.
Yeah.
So I would compare it to like a Whole 30 plus paleo, because really I didn't avoid dairy. So it wasn't like a full true Whole 30 diet. After losing 75 pounds, I picked up the Obesity Code by Dr. Jason Fung, and then learned even more about low carb and intermittent fasting, and incorporated like a 6 hour eating window every day. And so that combination of like the 6 hour eating window plus low carb was just like a perfect holy grail of weight loss. And I ended up losing the rest of it, just with that. I didn't do any medications or surgery or anything.
Yeah, no, I think that that's really good. Now, can you, for someone listening that may not understand some of the hormonal changes and the hormonal importance of why low carb keto may differ from like the standard low fat diet, what are some of the differences hormonally that happen when you follow like a satiating diet? Why is that so important to weight loss? Can you speak to some of those like leptin and ghrelin and all the ones that you kind of see daily being impacted by these satiating type diets?
Sure. So when I meet new patients, I actually do it in a group setting where I'll meet like 10 to 15 new patients to the practice. And I spend somewhere between like 70 and 90 minutes with these patients reviewing a lot of stuff. And that includes going back to what they've been taught for all of their lives, because a lot of these people are in their 40s, 50s, 60s, and like for their entire lives since they were kids, their parents were teaching them low calorie and low fat and all of that. And so formal USDA recommendations back then were 6 to 11 servings of grains a day, and make sure your fat is low and up to 35 grams of sugar. And so all of these recommendations were like actually created giving input from cereal and bread companies. And so it's so crazy that they like created these guidelines like at the advice of companies that make the foods that they want you to eat. So it's a lot of like erasure of that, or like just trying to forget and like learn new information. So I go over a lot of information about how calorie counting, like just a simple calories in, calories out, is like a very old fashioned approach.
Mhm.
Obviously, if you're eating like an insane amount of calories, it might, like, calories might matter, but it's just that old fashioned approach where like you can eat whatever you want as long as it's under a certain number of calories for the day, is like very old fashioned. We know so much about like the way the human body works, and we're still learning more and more about hormones these days. So the approach that I take is, if you have insulin resistance, if you have metabolic dysfunction of any kind, so if you have low HDL, which is your good cholesterol, or elevated blood sugar, or high triglycerides, or a high waist circumference, or fatty liver, or PCOS, like you have these insulin resistant associated diagnoses, then your body does not respond appropriately to carbs, sugar, or starch. And when you eat carbs, sugar, or starch, unfortunately, you're getting a glucose spike and a subsequent insulin spike. And the insulin is the hormone that's released from your pancreas that's used to shuttle all the sugar into cells for energy. But your system is like broken. If you have metabolic dysfunction, your system's broken. It sees that sugar or carb or starch, and the insulin gets released, and that's the fat deposit hormone. And so unfortunately, you're just growing fat every time you eat sugar, carbs, and starch. We all know someone, you know, like skinny cousin Johnny, who can eat a dozen donuts and stay skinny with a six pack. But that's not the people who come to see me for weight loss. Like, these people are have metabolic dysfunction. They're hormonally broken. I talk to them about like, you know, that loaded gun scenario where like there's this genetic makeup of your body, like a parent or a grandparent who has fatty liver or PCOS or type 2 diabetes, and they got that gene for it, but they can choose to have a different diet that impacts their hormones in a much better way. And so when you eat things like protein or fat or fiber, you're not getting this huge glucose spike and this huge insulin spike that can impact you for days, hours and days, 24, 36, 48 hours. It can take so long for your glucose to come back down, as you know, because you do, you know, CGMs, and you know the long lasting impact that these ultra processed foods can have. And so I talk a lot about that in that group, just to like make sure that people understand that this is all like a hormonal process, and not about not all chalked up to like just genetics or just how many calories they're eating. And there are other hormones too. There's like leptin, and there's ghrelin, which is the hunger hormone. And you really want to eat things like chicken and broccoli that suppress your ghrelin and don't cause some crazy hunger hormone spike 2 hours later. There's a reason why like 2 hours after you eat Chinese food, all you want is ice cream or cookies. It's like your hunger hormone is like, that was great, can we have more? Like, I want leftovers. Or perhaps something like, you know, ice cream, cookies, cake, anything with something sweet and fat combined. So yeah, a hormonal process for sure. And it's takes a long time for people to get it, but I feel like so many people, when they hear that, they're like, yeah, like, I knew this wasn't just about how often I eat. Because one of the most common things that people say is, I barely eat. I'm sure you hear that all the time. I barely eat. It's like, okay, but when you do eat, is it a granola bar? Like, that's your problem.
Yeah, yeah. And I feel like once people really break those chains of that constant that constant eating, that constant sugar spike, I often hear like, I feel so free. I feel so much less restricted. Like, I feel like that constant blood sugar up and down roller coaster is just, it's like chains on people. It's like this constant food noise in their head of like, I've got to eat, I've got to keep this blood sugar roller coaster going. I think it just gets really messy. But when they finally get these hormones regulated, it's just, they find like quote unquote true food freedom, because I know that's a whole other scenario. But I just think it's so freeing when you kind of understand how these hormones play into this. It really, it gives you a whole new perspective on weight loss. And I really do think calories in, calories out really oversimplifies things to a massive degree, as we both know. So that was a great explanation of how insulin and blood glucose and leptin all work. So tell us kind of, you work with so many metabolic patients, and what are some common barriers or common challenges that you say you see maybe over the years, or that you're seeing more of now, that are really becoming hard, or barriers to get over? And what are some like common advice or action steps that you give your clients in clinic?
Great. So I would say, oh my gosh, there's so many common barriers. Um, I feel like one of the most common barriers is like, I'll have patients who like almost believe it. They'll like sit back, right? And they'll like listen to all this hormone stuff. And they're like, yeah, that sounds right. But it's like, it's not until they just like take the first step and just like start that they don't truly absorb like how much this could really help them. And so that is a barrier that I commonly will confront, where I have this group visit, right? The patients, they are understanding, they're like actively engaged, they're talking back and forth during group. And then what ends up happening is they come back to see me in clinic 6 to 8 weeks later, and they haven't started anything. I'm like, why did you even come back? You haven't even gotten started, right? Like what
Yeah.
happened? They're like, oh, I was just waiting to see you one-on-one. Or like, oh, I was just waiting till September 1st. I was just waiting till after this birthday party I have coming up, or I have a wedding in like 3 weeks. I'm just waiting for that. Like, there's this barrier of like, just start. Like, you literally just need to get started. You know how much better you're going to feel. Like, you're going to have so much energy. You're going to be like motivated to want to be more active. You're going to be able to like run around with your kids and grandkids better. But there's just such a block of like, I've already tried everything, or the things that they have tried, it was for such a short term. It wasn't like a full commitment. But that tends to be like the first roadblock. And then another really common roadblock that people encounter is like the beating yourself up roadblock, where unfortunately they get off track for like one day or like one meal. They'll go to like one event and have a piece of cake and it's all over. And I try to tell people that like, this is such a long process, and forgiveness is just like key. Like, just forgive yourself, just move on. Because if you beat yourself up and you just keep like, I guess, focusing on the negative, focusing on what you did, you're just going to continue to make the same poor choices when it comes to diet. And then unfortunately what ends up happening is, over the course of that weekend or the following week or the next month until the new month starts, you can end up unfortunately like backtracking all of the progress that you would have made, and then you give up on it and start to see it as like perhaps something where it doesn't even work. Like, it's not even something that works for you.
No, totally. I think, yeah, with barriers, I think we could go like all over the place, where it's emotional. Is it situational? I think for you, it
Right.
sounds like you had like a lot of stress, and you were over pressured, probably a lot of, fatigue with being an undergrad. And we could go all over the map, but I think figuring out what are really those triggers, what are those points that are like throwing you off, and then figuring out kind of a plan to go around that. So, I think when I work with my clients, it's like figuring out what are most impactful and what's throwing you off. And then working individually, it sounds like you do a lot of that as well. And just figuring out, the most realistic plan around that. Now, I have to ask, because this is like trending, and you're the total professional expert on this. So I want to know your thoughts on the most popular weight loss topic right now: Ozempic, Wegovy, all these weight loss meds. And I have to throw this out there, because I get accused of this all the time online. I am so not against these medications. I think they can be so helpful for some. I think I have a little bit of issues the way with some people are marketing them. But tell me what you
Yep.
think. Tell me how you're using them. Tell me what you think. I think this is the future. I think peptides are the future. I think this is really cool. But can you talk about some of the ways you use these in your clinic, and And then we can kind of go into how people can maybe wean off of them successfully and all that. But kind of give me your general overview on these GLP-1s and your just thoughts in general from a broad perspective.
I would say when it comes to like being at a, as informal as just like being at a party with friends, all the way to like the formal setting with patients,
Yeah.
GLP-1 agonists are like the most common topic that I get asked about. And they're like the most common medication that's prescribed by obesity medicine doctors. And now, like, I mean, primary care is also taking a huge step towards the, GLP-1 agonist game. So here's the thing. There are lots of risks and there are lots of upsides and benefits with these medications. So we can talk about like the benefits and we can talk about the risks involved and include like a lot of barriers to these meds. So GLP-1 agonist medications like Saxenda, Wegovy, Ozempic, Mounjaro, they were originally created and marketed as diabetes drugs, and now we are having the FDA is approving versions of them like Saxenda and Wegovy that are specifically for weight loss. But Ozempic and Mounjaro are still FDA approved type 2 diabetes medications. There are indications for these meds whether or not you have type 2 diabetes. So if you're pre-diabetic with PCOS, morbid obesity, and central adiposity, like you gain all of your weight around your belly, these medications can help you a lot. And so you don't have to be full-blown type 2 diabetic, especially if you wanted to take a medication like Wegovy or Saxenda, which are FDA approved for just the obesity
Yeah.
weight loss aspect. But these meds work because they are agonizing the GLP-1 receptor, and they work in three different places in your body. They work in your brain to decrease overall hunger and craving for carbs and sugar. They work in your gut to slow down gastric emptying, and so you get like fuller faster. And then they work directly in the pancreas to help reverse some of that insulin resistance. So it's kind of like being on three weight loss drugs all at the same time, but you're only taking an injection either once a day or once a week. The meds range in price from $900 to $1,400 a month. And
Wow.
so a lot of insurance companies are just like not willing to cover them. And so in terms of barriers, that's like one of the most common barriers that happens is like insurance just puts like a full stop. Like if you're not diabetic, you're not going to be on a GLP-1 agonist. And if you think about how much money comes out of your paycheck every 2 weeks to pay for health insurance, most of the time it's not
No.
$1,400 or $1,600 coming out of your paycheck every month for health
Yeah.
insurance. So they're looking at that just like from a pure monetary perspective. Like you don't even give us this much money per month, so we're not going to cover a drug that's this expensive, which is unfortunate because there is a lot of upside. These medications are helping people lose like 15, 20, 25% of their body weight over a 6, 12, 18-month period. And I see it very regularly. But the most important thing about the GLP-1 agonists and what I found in clinic over the years is like first and foremost, low carb has to be like in place. If
Yes.
you're hoping to get on Wegovy while eating like pizza and pasta and bread and chips and cookies every day, it just doesn't work well. Like I've had patients literally gain weight on these drugs because they're looking at it like a safety net, like I'm on Wegovy, I can eat whatever I want. If only, right? Like if only we had a drug where you could eat whatever you want and like slim down magically and have great metabolic health and amazing markers. That does not exist. And so like the first and foremost important intervention is to like get rid of the ultra processed foods and carbs and reduce sugars to, I mean, zero. I don't give usually people like a limit to the number of sugars to eat per day like the USDA does. I'm like, try to minimize to nothing or limit them to almost nothing. But the dietary change is really key, and focusing on protein, fat, and healthy fiber is going to be vital, because if you're really not hungry from the injection, then when you do go to eat, it has to be the right things, or you're going to get like muscle wasting or a weight loss that's not really what you want. Like you're going to lose muscle instead of body fat if you're not eating protein and fiber and healthy fats. And so yeah, it's very complicated with these injectables. So the black box warnings for them are can't have a personal or family history of multiple endocrine neoplasia type 2 or medullary thyroid cancer. And so there's a lot of pause given if you've had a history of that or a family history of that. And then pancreatitis, there's, a history of where patients have a history of pancreatitis. There's like a personal history, like say they drank too much alcohol at one point in their life and were hospitalized for pancreatitis. Some people have like chronic pancreatic inflammation. And given that this medication like works directly in the pancreas and can affect the pancreas, it can cause, another episode of pancreatitis, which could be deadly. And so there's some, certain medical conditions that really limit the use of these drugs. I would say like the easiest patient to prescribe it to would be someone who is severely overweight and type 2 diabetic who's poorly controlled and struggles with cravings and overeating, because if they're taking an injectable like that and they don't have any of that family history of the, medullary thyroid cancer or multiple endocrine neoplasia, they would be like a great candidate. They're going to be able to stick to protein and fats and fibers and eat a lot better with their, with a new meal plan that I provide to them. And hopefully the overeating problem goes away because their stomach is getting fuller faster since it slows down the gastric emptying.
Yeah, I love that. And I love that they work in so many different ways. I think people have a little bit of a closed mind on this and they think, oh, it just suppresses the appetite. It has no other hormonal functions. And I think that that's a very narrow minded view. And so I thank you for that explanation. Now, do you find that most people will need to stay on these for life? What are you finding? Do you find that people like, I mean, obviously it depends on how much weight you need to lose, right? And, or kind of your individual situation, but what have you found in clinic, like, in terms of length of being on the medications? Like I've kind of seen it all over the board.
I have like differing views on this myself. So I like the way that I lost weight, as I talked about, is just like all lifestyle change. Like I did a very low carb approach and incorporated intermittent fasting, and I sustained the weight loss for 7 years like that. And so like that is my approach. And if I have a patient who's like me and wants to do it that way, all the more power to them. I'm not trying to put every patient that I have on a GLP-1 agonist. If I have a patient who feels really strongly about needing like medication help, and their insurance is willing to cover it and it's in stock, because I didn't even talk about the barrier of like stocking issues. Like nationwide, there's a shortage right now of all GLP-1 agonists, including the ones that are used to treat diabetes. But if it's, in stock and appropriate and they ask for it and they don't have any of the risks and they want to be on that, like for extra help, of course it's appropriate and like, let's try, right? So I just want people to be successful in whatever way that I can get them to be successful. And so sometimes I take the approach of like, if if you're feeling really strongly about not being on a med for the rest of your life, like let's try all of these dietary changes. Let's try all these other tools that we can use for weight loss, like exercise, intermittent fasting. Let's make sure that your sleep is in order and your mental health is in check and that you're having enough water. Like there's just like all of these other tools and variables that can be in place in addition to a low carb, higher protein, higher fat, higher fiber diet. And so if they're taking all of these measures, they can come off the drug. And I have had many patients be able to come off of GLP-1 agonists, especially recently with all the shortage issues. Like they've started the GLP-1, lost 40 pounds, and now it's out of stock anyway. And so it's something that I like warn people about in that first initial visit with me too. Like, just so you know, like you need to be able to fall back on this diet. Like it has to be like the base, most important intervention that you make, because at any point your, insurance company could change their formulation, stop covering it, or the pharmacies could be out of stock nationwide. So it can't be like the end all be all. But there's a lot of doctors in like the field of obesity medicine who take the approach that like, obesity is a chronic disease and illness and needs something, needs medication chronically. It's like some people do, and some people can also rely on lifestyle changes. It goes back to that loaded gun metaphor. Like if the person is not choosing to pull the trigger, they can have all of that genetic history, morbid obesity, type 2 diabetes, fatty liver, PCOS on both sides of the family, multiple family members, and choose to do all the right things and follow all the right tools and not actually need a medication long term. It depends on the person. Everyone's so individual, and like I see patients every 6 to 8 weeks, and some people at some point may plateau and need a medication. But I usually start with like more simpler and cheaper meds. Like metformin can be a really great weight loss drug, and it's $4 a month. So it doesn't necessarily have to be, going from 0 to 100 right to the injectable.
Yeah, I love it. And I really love that you talked about how important it is to couple, like you can change your diet, you can change your lifestyle and see great success. I have a lot of clients that are doing like my program and on the semiglutides and on these medications simultaneously, and they see incredible success. And then they're the ones that are messaging me 6 months later, like, hey, I've kept off a 70, 80 pound weight loss and I feel fantastic. This is the first time in my life I've gotten rid of the food noise. I feel in control. And it's because they've controlled those hormones. They've changed their diet in combination with this really powerful med. So I think like you speaking on the importance of both and how they can both be helpful is really cool. But I love that you also mentioned that obesity doesn't always have to be a lifetime or a chronic disease. It really, I mean, you're a living proof, right? You've controlled it, you've overcome it, you've put it in remission. So I think that's awesome. So any other tips would you say for someone coming off of these semiglutides or wanting to come off of these medications and being successful with low carb keto? Do you have any? I mean, I think taking, control of childhood trauma, stuff like that can be really helpful. But can you think of anything else action steps wise that you would give advice on?
Definitely you just touched on the mental health component. Like if it's a bad time in your life, like say you're going through a divorce or a move or a job transition or something like that, it's not the right time, I would say, because if you are going to slip back into old ways, like say you have a history of binge eating disorder or some kind of disordered eating or an inappropriate relationship with food, like you're going to slip right back into that if you don't have this new medication on board that's suppressing cravings and like helping with food noise. So you have to kind of be at like a really good, stable place with your mental health. And then I would say, protein and like fat has really been key, like dietary protein and dietary fat. Like if those are your kind of go-to, like if every meal of the day, whether you're like a 3 meal a day or a 1 meal a day kind of person, if every time you eat, you're like focusing on getting enough protein and getting enough fat, then you're going to have much better cravings than you did before, especially if 50 pounds ago you were eating a lot of carbs and sugars. Because those people who do like 6 small meals a day or 4 small meals a day, and every single meal and snack is just like one sugar to the next, they were just so dysregulated. And so now if they're following a low carb diet with this injectable medication, I mean, they might be okay to come off of it, especially if, I mean, a lot of times we taper. So if you're like feeling really strongly about coming off and you want to taper off, just like how we taper up to the highest dose, you can taper off to the lowest dose. And so you can just do either half the dose or like the next step down, 1 month at a time, like really slow. And so it kind of like lets your body learn how to regulate its hormones by itself, not like requiring this medication or being dependent on it. And I feel like in this field, as a dietitian, a future naturopathic doctor, as an MD, like we have to respect people's individual journeys. And if like someone comes to me and they're like, I'm a vegan now, or someone comes to me and they're like, I want to come off this medication, like I'm going to support them and try to just like put myself in their shoes and understand where they're coming from. And so over the years, I've like added a whole vegan section of like where to get your protein and healthy fats from if you're vegan. And I've tried to like see how to taper people off these medications because everyone is so different. It's just, it can't be the end all be all. And some people, when they go on a low carb diet, the best they can do is 80 grams of total carbs a day. But like, if where they were at before is 300, 80 grams is way better, and they're having way less blood sugar spikes on 80 grams a day. So yeah, it's just a very individualized process. But the best piece of advice that I can give for sure, like what I stand by is the learning to forgive yourself portion. Because I think so many people in diet, like this classic diet culture is just like, you just beat yourself up when you get off track. And, it doesn't take one salad to be skinny. And if you eat one donut, you're not going to be morbidly obese. So I just think you have to learn how to forgive yourself and just get back on track immediately, like the same day, not even just, oh, tomorrow I'll be better. Like for dinner tonight, I'll be better. Or like when I get home from this naughty outing where I had lots of alcoholic beverages and nachos, like as soon as I get home, I'm going to have like, some nuts and berries. Like you can get back on track the same day. You don't have to wait until the following day or the following week.
Yeah, I love that you bring that up because I feel like the dieting culture it can get very, very emotional. And I think stress, emotions, all that plays such a strong role into it. I really didn't see true weight loss success until I pulled the whole emotions out of it. I really had to look at it from a purely like, this is very subjective. Like, I'm going to get right back on track. I was really struggling. It took me a long time to win the battle in my mind. And that is when I ultimately saw weight loss success. I had a lot of the same stuff. I was an overweight dietitian. Like it was just felt everything about my entire existence felt wrong career wise. And so, but once I pulled back on those emotions and like really like what you said, it just was the next meal. If I messed up, it was the next meal. There was no beating myself up. There was no guilt. There was no punishment. There was no like, oh, I'm going to intermittent fast for 3 days. It was very like just matter of fact, I'm right back on. And then kind of, now that may not work for everyone. I think there's therapy and counselors and their whole 9 yards, you know. I'm just kind of telling you what works for me. So
Temple,
give
I
me,
have a question for you.
yeah.
I have a question for you because I deal with this a lot and I've dealt with
Yeah,
it a lot over the years.
yeah,
How do you deal with, if you have to deal with this regularly, dietitians who are like severely against demonizing ultra processed foods and sugars? So like the ones that are like they're very attuned to disordered eating and they
mhm,
feel like when you go on a low carb diet and your focus is like protein, healthy fats, and fiber, you're eliminating foods that like people need or like want or like should be part of their life, because that is something that I have struggled with since I don't even know, like since the day I became a doctor 10 years
yeah.
ago. I mean, it has been like a really long term problem, and I like hate butting heads with other
I know.
professionals, and it's like in the clinic setting, but it's also like on social media. I'll have comments from dietitians who are like
Oh yeah,
famous dietitians commenting something that I'm like, you know, like things that I'm saying could be causing disordered eating. And I'm like, oh my God, minimizing certain foods for, for like improving metabolic health and like hormone balance is not like me trying to cause disordered eating. So it's like, it really is like painful, like to be part of that, and like to have people think that you're trying to cause a problem when really you're just trying to like reverse someone's metabolic dysfunction.
100%. And I will tell you this, you are not alone. I deal with this as well. I get constant online attacks from this. And what I say is I try to just bring it all the way back down to like, no, this is like the science of what happens to people when they're addicted to sugar. This is like the dopamine effects. This is what their brain is on sugar. And this is the hormonal effects. And honestly, like I've had just so many people come to me and tell me they feel true food freedom when they're free from the ultra processed foods. It's like that is kind of my counter attack, I would say, but also understanding that dietetics, and this is kind of a sad statistic, is the number one profession in the world to have eating disorders. So a lot of people go into dietetics that are struggling, one, with an eating disorder themselves, have an eating disorder, and or are currently like battling some sort of issue with food. And so I think it breeds a lot of people that have like almost like a little bit of a trigger with that kind of stuff. And so I think those of us that may have not struggled with that and or are helping people in the metabolic space just become natural points of attack, because we are kind of trying to help people, but I think we tend to accidentally trigger others that may have had issues in the past with their own eating and food relationship. So I just try to keep a very like, this is not my heart's intent. I really truly mean to help people. And if you take it this way, I'm sorry. It sounds like a you problem, not a me problem. And really just try to say that a lot, and it truly, like anybody who knows us and anybody who truly watches our stuff, and I really believe this from the bottom of my heart, knows that we truly want to help people. And we both come from a place of unhealth. Like it's not that we like were super fit and like fit fam and skinny and like we're just trying to make a ton of money like helping people. No, like we were very sick and on our way to destruction in a lot of ways. And so it's like we have been where it's not good, and we relate to a lot of people and we just want to help. And so I think people that follow us and listen to what we say really know our heart's intent. And so, but it is hurtful when we get those. I had a really popular bodybuilder who had like 9 million followers stitch one of my TikToks, and it gave me like 10,000 TikTok followers, which was awesome because I got like a lot of people, but it was like so hurtful because he totally like twisted what I said. And I remember like I cried. This was the first time social media had made me cry. And my husband was like, no, like anybody who truly watches your stuff knows that that is not your intent. And I think going back to like, this is my why. I'm being a little bit TED talky here, but I just truly think that anybody who doesn't know us may have that. But it is a field. Also, the dietetics field, and this is the last thing I'll say about that, has really taken kind of a weird, not a weird turn, but it has taken more of a approach of like all foods fit, healthy at every size, which I'm not saying you can't be healthy at a larger size. I think that is possible. I think your risk is still elevated, but it has taken a very like interesting turn in terms of like food freedom, and in the efforts to not demonize a food and be very welcoming. I think we've almost gone too far in terms of allowing just there's just being just the lack of transparency and lack of scientific honesty about what obesity can do, will do, and eventually does bring risks to. And so I think the dietetics field's pendulum has swung a little too far in terms of what it is preaching, if that makes sense. I hope that made sense.
It does. You're so wise and you're so helpful. I've
Yeah.
come to you in the past because of some people like bullying me on social media. You're always so nice. I'm like, oh my God, you might think I told someone to starve themselves for 100 days. Like
I
literally.
Yeah, it's very bizarre. Well, I saw a quote and I put it on Twitter. It's something like it, society has started eating so much junk that like when you eat real food, it's now considered a diet, which I think is so wild. Like, we're literally telling people like just eat protein, eat real food, eat like strategically minimize carbohydrates. Like just we're not like saying do a cookie diet or like a grapefruit diet or soup diet or something like really bizarre. It's just like,
Right, right. It's not a fad. Like it's
no.
not a fad, not a cleanse. It's not anything like quick and easy that you do for like 3 weeks or something. It's like permanently eat cleaner foods, like just
Yeah.
like foods in their whole form.
Yeah.
Pretty
And
simple.
I think that's really cool too. Like I know of Chris Palmer, his book Brain
Hmm.
Energy, and like all of this research that continue to come out about how important metabolic health is. I'm sure you see it every day in the clinic. Like when you fix people's diet, the conditions that just wash away and that are improved is just, incredible. I don't know. Like you're doing it every day.
Yeah, I'm so impressed by the improvements in things like PHQ-9, the depression scale, and GAD-7, the anxiety scale. It's like unbelievable how much better people get, even if it's just subjectively.
Yeah.
Like, how many times in the past 2 weeks have you had trouble sleeping? Or how many times in the past 2 weeks have you felt panic or anxiety? And it's like the numbers just dramatically improve with a 10 or 15% weight reduction on a low carb diet. And so, like, from a mental health perspective, depression, anxiety, stress, disordered eating patterns, all that stuff just like improves dramatically. It's not zero. I mean, like, how can you possibly go, from depressed to zero? But if it's just like a little incremental improvement and it's like that much easier for you to like get out of bed every day, that's like amazing. And I always appreciate that in my patients and like the mental health improvement. I feel like I'm a therapist half the time because people are really choosing food in order to cope with their life's stressors. And so I don't mind that part of who I am. Like my father was a social worker, and I thought about going into social work instead of going into medicine. And like that's like a badge of honor for me for people to like open up about their life struggles and stressors.
Yeah, and they trust you, and they many of your patients probably know that you've come from where you've come from, and that you can relate to what they're going through and what they're feeling, and you've had these really hard life things that have happened to you. You lost your sister, your best friend, you lost your father to these horrific things to go through. So it's I think that there's something to be said about physicians and practitioners that can really truly relate to their patients. So I think that's a big deal. It does provide that know, like, and trust factor. Like it's just there's something there, there's a connection there whether they realize it or not. And so I think that's really great. Well, tell us kind of what a normal day in your life looks like. I know you've done intermittent fasting before. I know you kind of follow low carb keto. What is like a normal day for you to maintain, and what does that look like for you?
That's such a good question. So my maintenance is very similar to my weight loss. Like I really haven't changed that much. So I still do intermittent fasting and I still do low carb. My focus on foods is definitely like proteins, healthy fats, fibers all day long. I will typically eat in a 4 or 6 hour eating window. And honestly, a lot of the eating window stuff has to do with convenience because of clinic. So I'm in clinic like 8 to 4 is my like patient facing clinic hours. And so a lot of times during that like 8 to 4 hour period, like on a work day, I really don't want to eat a particularly big meal or like a meal at all, just because I don't really like the way I feel like right after eating, that like bloated feeling and then like continuing to see patients. I feel so energized and like smart and like quick on my feet when I'm fasted. And so a lot of times on a work day, I will have like I don't know if you've ever heard of mud water, but
Yeah.
mud water is like this is a matcha green tea one, but it has mushrooms, and it's like
Mhm.
multiple different mushrooms that have different beneficial factors. I'll have something like this with a little bit of almond milk or coconut milk in the morning, or I'll have just black coffee, and that will hold me over until lunchtime. At lunch, I'll have like either water with electrolytes or some broth at work. And then sometimes if I want to eat lunch, I'll bring just some like quick veggies or protein, like leftover chicken or something like that at lunch. But I would say the majority of the days I'd rather just like eat at home after work. And if I'm doing that and I'm eating in like a 4 or 6 hour window, I'll try to have just like one big meal during that window. And the one big meal for me has been like pretty great for maintenance. It can be really hard for some people to do one big meal a day because it's like hard to eat that much, like that quantity in a small time. For me, it works because of timing. So I'll typically eat something like, one of my favorite meals is like ground turkey with taco seasoning, and I'll make it with like sometimes I'll eat it on a bell pepper with cheese melted over
Mhm.
top, or I'll eat it like by itself with an avocado and sour cream. So I'm getting lots of good protein, a couple servings of vegetables, and some fats. And I sub out the ground turkey with like ground chicken, sometimes ground beef. And so I kind of just like make it interesting with the different proteins that I use. But default diet is typically some kind of protein, some kind of fat, some kind of fiber. And I just do that from like a purely, uh, you know, metabolic perspective. Like I know that's what's best for my body type, and I don't want blood sugar spikes. I don't want insulin problems. I don't want to feel fatigued anymore.
Yeah.
And so I feel really satiated and satisfied. And then if a couple hours later I feel like I need something, like I'll have some celery and peanut butter or some nuts and berries for dessert, or I'll make something like peanut butter almond flour cookies or something like that with swerve. So I do eat some like, like classic keto recipe
Mhm.
type things, or sometimes I'll buy things that are like actually processed in a factory or facility. But even when I do, like if I'm buying something that's been processed, it's not something that's like ultra processed to the point of like not being able to recognize the ingredients on the package.
Yeah, totally. No, I eat very similar. I think the few bigger meals, and that tends to hold me over maintenance wise. So I think that that's very similar. Now, have you had any like setbacks where you've gained some of the weight back and had to kind of fight that? What does that look like, or has it kind of all been downhill? What does that look like?
Yeah, so one of my biggest setbacks was actually like when my sister passed away and lost her battle to cancer. So that was back in 2017, and that's when I like had already lost like 75 pounds. Like she saw me and my brother-in-law lose like 75 pounds before she passed away, and she was so proud of us and saw us like, getting our energy and our health back, and she knew that we would be around and be strong for her kids. So, but one of my biggest setbacks was just like losing her. It was just like this state of just like comatose, like I just couldn't deal with life. And I don't know, it's almost like you dread it for so long, and then when it actually happens, for some people it's almost like a release where they just like feel better, and some people it's horrendous where they can't get out of bed and they feel worse. I was just like so numb, and food had helped me before, and so unfortunately, and it's not just like regular food, it's like the processed stuff, so I went back to eating like chips and chocolate milk and pizza and pasta and crackers and all the crap. So that happened, and that was such a big setback, of course. Like, how could it not? And at that point, you're just in survival mode. So that's all I was thinking
Yeah.
of. It's just like, I need to get to tomorrow. Who cares if I have like a peanut butter and jelly sandwich? So the way that I got back on track at that point was that's when I like decided to get really strict with my carbs and introduce the intermittent fasting. And so the intermittent fasting really like boosted the weight loss and like got me back on track and feeling like I was in control of something again.
Yeah, no, I think that that's good. I think that I had a little bit of a slip up too, and I think for anyone that's listening, like we're certainly not perfect, and we struggle too, and we've had these like moments, and I think that that's a perfect example of like getting right back on the wagon when and not giving up on your journey and understanding that a lot of people have that and just to keep pressing forward. So yeah, thank you for sharing that. I think it's good to understand the relation that we're all kind of human, you know? So for,
Yeah, that's where I get the forgive yourself thing is like, I have to do that,
yeah,
like it's like me saying it is like reminding myself, like, forgive yourself, you screw up, like
it's
it
life.
happens,
Yeah. Well,
Yesterday I went to a baseball game and had a few M&Ms. Like I had a few of my nephew's M&Ms, and it's like, am I going to beat myself up all day today and go buy like a pie and a dozen donuts? No, like I'm just like over it. Like for dinner last night, I had a great meal and I just got over it immediately, and I'm not going to be upset about it. Like my blood sugar spike from yesterday has already been improved, you
yeah.
know?
Yeah. And I also feel like some of that those slip ups and those are learning opportunities. Like you go back and you eat like that and you feel like a dumpster fire. Like, I don't know about you, but like I can remember those times I'm like, I feel awful. Like I just feel terrible. Like I'm getting acne. I can't sleep. I'm depressed. Like everything feels awful. And now I'm like, okay, this is directly correlated with what I'm eating. So it's like, it's almost like putting that imprint in your mind, like, okay, when I eat like trash, I feel like trash. And so it helps
Yep.
reinforce like why I'm doing this. And it helps you just realize like, okay, this is makes this journey worth it 100% for me. So,
It's crazy how many people go through life just feeling like bloated and tired and crappy all the time. Like
oh
they don't even realize how bad it is, They're just like, oh, I have IBS and fibromyalgia. It's like your entire body is inflamed, in fact. You know
yeah.
what I mean? Like they're blaming on IBS and fibromyalgia when like from head to toe, your body is just
Systemic
like a sugar
inflammation.
cube.
Yeah, systemic
Right.
inflammation. Yeah, no, totally. No, I think you're right. I have clients tell me all the time, they're like, I came for you for weight loss, but my migraines are gone. And like you mentioned, depression, anxiety is lessened. Like it's just like, there's so many rewards to doing this. It's just, yeah, the payoff is great. So for my last question, just give us one piece of advice or something that you're thinking of, anything that someone may be on this journey and they're ready to throw in the towel, or maybe they haven't even started yet. Is there whatever comes to mind, a bit of hope? I think your journey is all inspiring, but anything that you can think of that comes to mind that may just throw out a little bit of encouragement for someone today.
I think one of the best things that people can do is just like take the first step, like just take it one day at a time. And like it can just be like just think about like the next meal that you're eating. Like don't think about it like this insurmountable task. Like I have to lose 100 pounds. It's going to take me over a year to do it. And it's going to be like this grueling process. Like just think about the next meal. Like you're going to have chicken and broccoli for dinner tonight, and you're going to put some cheese on the broccoli. Like that's your next meal, like one step. Because if you look at it like this whole process that's going to take you years, like I want to reverse my type 2 diabetes and get off of all of my blood pressure meds and my cholesterol medic, like it seems so difficult when really you could just be planning your next meal and like planning maybe your next week where you're doing like meal prepping for a few days of work. And so I think one step at a time is really good. And then my favorite tip to give people is intentionally spoil your appetite, because we all have parties we're going to, events, weddings, whatever. If you know you're going to be tempted, absolutely eat something before you go and do the opposite of what your mama told you growing up. Just like spoil your appetite
I
on
love it.
purpose. Because if you go there totally full, like you literally just ate a full meal, like you had bacon and eggs and then you left for the party, you're going to show up and like maybe you eat one or two bites of something bad, but you're not going to be tempted nearly in the same way as if you show up to an event like that famished and starving.
Totally.
So I love to tell people to spoil their appetite and just keep things like nuts and berries and like stuff that's like cheese sticks, things that have like protein and fat in them, just like keep them either like on your person, in your purse, in your backpack, in your car, wherever you have to keep them, so that you have that to like default back to. It's really hard, but like at the end of the day, you don't want to be like one of those people at the party who's like actively eating a cookie, being like, oh, I'm trying. Like, how many people are like that?
Yeah.
Everyone at a party is like that. It's like, you can't just let yourself be that person at a party anymore. Like, you're that person, you've been that person for 5 years or 10 years or 15 years. Like, when does it end? When are you not going to be the person anymore who's like eating a slice of cake saying, I'm trying? Like, you're not trying anymore. Just do it.
I love it. I love it. Two great bits of advice. And I tell everyone to like where to find you, how to get access to your stuff. I'll put everything in the show notes as well for anyone listening. But yeah, tell us where they can follow you. You put out great content on TikTok, Instagram. Tell us how to find you.
Thank you. So TikTok, Instagram, and Twitter, which is now called X. The username that I use is just Kevin Gendreau, Kevin Gendreau. And so pretty easy to find there. And that's where I'm most active. I would say most active on TikTok and Instagram for sure. And then I have a website, which is just kevingendreau.com.
Perfect. It was a pleasure. Thank you so much for coming on, and I look forward to continuing our friendship. But again, thank you for sharing your wisdom and knowledge. Again, it's a pleasure.
Thank you so much for having me.
Yeah, you bet.